Dear colleagues, I'm glad to be here, and although it's very difficult for me to talk today, I'm still very glad to be the first in this session. And my speech is called Smoking in Russian Federation and Points of Reviewing the Preventional Strategy for Smoking-Associated Diseases. And let me introduce myself. I'm a cardiologist, PhD, and I'm also a manager of a health care system. The purpose of the study was to evaluate the smoking status in our country today and to develop proposals for changing the strategy for primary and secondary prevention of smoking-associated diseases in terms of motivation to quit smoking. Our survey on smoking problems was based on the information that was posted on the website of Russian Public Opinion Research Center on July 12, 2022. And based on the obtained results, the suggestions to change the strategy of primary and secondary prevention among smokers in terms of motivation to quit smoking were formulated. And as you can see, the results of the study show that the share of smokers has reduced from 41% in 2013 to 33% nowadays. And the share of those people who quit smoking rised from 10 to 17%. But still, there are a lot of people who continue smoking, and among them there is a huge amount of such called heavy smokers, of about 20% people who smoke pack or day or more. But the proportion of occasional smokers who smoke several cigarettes per day or week has decreased from 20 to 13% since 2009. Some changes in smoking profiles occurred. Thus, you can see that before, in 2009, almost 50% of smokers were at the age of 18 to 44 years. And now, 38 to 42% of smokers are at the age of 25 to 59 years old. That means that those people who smoked in 2009 are still smoking now. But we see good things, such as we predict that young people aged 18 to 24 will become the drivers of a new model of a non-smoking behavior. So in 2009, 22% of young people smoked a pack a day. Nowadays, there are only 20% of such people. And the total share of smokers aged 18 to 24 decreased by 1.7 times. Considering the quit smoking status in Russia, I should say that 62% of Russians who smoke want to kick a habit. But the share of those who don't want to give up cigarettes increased 1.5 times from 19 to 31%. Moreover, smoking cessation is perceived as a forced measure. In 2017, many people had a strong desire, but today health problems influence the decision to quit smoking to the same extent. And only 4% of smoking will be able to stop due to the growth in the cost of cigarettes. Although among young people, this option is mentioned by every third. So as we can see, there is a huge amount of people who are not going to quit smoking, and we as a doctors and as a health care system should do a lot to change the situation. And what should we do as a doctors? We should definitely revise the approaches to motivate smokers to quit smoking and develop a comprehensive harm reduction approach for those who don't intend to quit smoking. We should also create conditions, including the opportunity to receive information about scientifically proven less harmful alternatives to traditional cigarettes. And this approach is being mentioned in a paper of ACC expert consensus decision pathway on tobacco cessation treatment. This is an American paper which contains a posture that current smokers who are not ready to quit now should discuss with their doctors the use of non-combustible tobacco product if not interested in using stop smoking medications. There is a lot of things that the government and the health care system is doing now in Russian Federation, such as prohibition on the use of tobacco products in public places, ban on the sale of tobacco products to persons under the age of 18, and the ban of advertising tobacco products, as well as an increase in prices for tobacco products due to tax measures, and printing the warning labels on cigarette packs. But there is still a lot to do in the system, in the health care system, and the most difficult part of it is the education of health providers and the smoking cessation specialists, or so-called health coaches. And in the strategy of primary and secondary prevention, we should develop personalized recommendations for quitting smoking, depending on the patient's gender and age status, taking into account the degree of tobacco dependence and motivation to quit smoking. Already a lot of things was discussed today about the risk reduction and the use of THAs and non-combustible products. I should also mention that there are many positive results of THA studies which show that non-combustible tobacco is less toxic, and the switch on the THAs stops progression of atherosclerotic changes caused by cigarette smoke in viva, and many other researches that show good things about this concept. So in the conclusion, I would like to say that today we have heard a lot of good clinical practice, such as Kazakhstan, New Zealand, and other European countries. And I think that we also should continue developing and the implementation of harm reduction principles for those who don't intend to quit tobacco use. So thank you.